So in the area of skin tightening, let me tell you that it has been revolutionized, not only by lasers, but by other devices as well. Basically, if you put heat into the skin, you can change it. And if you put a lot of heat in the skin in a short time, you can get a result, though there's probably a lot more downtime. Or if you put a little bit of heat in frequently, like every day, for a month or 2 months, you can get pretty much the same improvement. And it might be in texture, tone, firmness, superficial wrinkles, even deeper wrinkles. Of course, all these things are used in association with toxins and fillers. And these days, we're doing less lifting and more filling. It's like a balloon that loses its air. The skin becomes somewhat wrinkled. So fill that balloon again with fillers, and the wrinkles tend to disappear. So that's really the essence. It's a combination. Fillers, toxins, lasers, radio frequency, ultrasound, all these things are being used at different levels in the skin to change the conformational nature of collagen and elastin and the thickness of the dermis and indeed the superficial fat. These are all important layers to consider. So the question about is light better than, for instance, chemical peels or dermabrasions is a very important one, because I don't think we should throw out the baby with the bathwater. Chemical peels are still very important to what we do. And it is true that the American Society for Laser Medicine and Surgery tends to promote light-based or energy-based systems. But we cannot forget that chemical peels and indeed manual dermabrasion remain very important, and they're very inexpensive to perform, and so they should be part of our armamentarium. However, with light you can often be quite specific. If you want to target a certain organelle, you can do so. If you want to target the mid-dermis, for instance, you can do so. If with the ultrasound devices that we have or radio frequency, you want to tighten up the SMAS so as to get a tightening of the facial skin, you can do that. Now, with chemical peels, you could never do that. Indeed, with dermabrasion, you couldn't do that. I think it's our ability to selectively target certain areas which has critically changed our ability to have a more specific response. The future provision of this service, I can honestly tell you, is going to be based both in the office and also at home. You know that there are at least 3, probably more, big companies that are involved now producing home-based devices for skin tightening. The main ones are Palomar, making the Palovia, and Philips, which make the Rayora, which is for sale in England and in Holland. Those 2 devices are home-based, fractionated, sophisticated, non-ablated devices that you might use every day for a month, for instance. And you get real results that you might see after 1 or 2 treatments with the office-based devices. So I don't think in any way they are going to diminish or reduce the number of referrals to laser offices. I think they will augment them, because it's a different class of individual. It's a different type of individual who will go into a Neiman Marcus or a Saks or a Harrods and buy one of these devices for use in the privacy of their own home, whether it be skin tightening or hair removal for that matter, versus going into a clinic. The costs also probably should be more advantageous to those who are obsessional and more methodical. For instance, if it was me, I'd forget to do it every night. But those who treat themselves with these home-based units are going to get some very nice results. Having said that, every single month there's something new that's coming out which actually is an advantage in the office-based arena. And I guarantee you that these devices are going to become smarter, smaller, more powerful, more predictable, and with less pain over the next several years. And you watch out. Rox Anderson is talking at 1 o'clock today about the treatment of acne, about the prevention of acne by treating sebaceous glands. I think that's amazing that you can actually prevent, or you will be able to prevent the onset of all this inflammatory a disease which causes so much suffering and scarring and so forth for these kids in their difficult years of their lives. So overall, I would say that the future is extremely bright